Thank you. So this morning we have a forum which is talking about two areas, but they are interrelated, I believe. And what in my section is about effective communication. And when we talk about effective communication, what does it mean actually? So it is defined as verbal speech or other methods of relaying information in order to get a point across. So when we talk about other methods, I think we always, if you're talking about a procedure, for example, right, it's always good to add in, some visual aids, okay, because then you will be reinforcing the points that you make. And the most important thing is to make sure that it gets through to whoever is in front of you. Yeah, it could be the adult patient, okay, or it could be the mother of a patient, and so on. And I think I like to stress here that the communication should be bi-directional. Okay, I think a lot of us, when we run clinics especially, we probably have to time ourselves, right? It's probably less than 30 seconds after we say hello, how are you, and all that, and then we jump in already, right? Probably in a setup of a busy clinic, you do have to do that a little bit quicker. But depending on the context of what you need to communicate, right? Certainly if you are delivering a bad news, a new diagnosis, one that is maybe like cancer, okay, or a terminally ill patient, then you really have to play the role of listening to, right? So it is bi-directional, it's not uni, okay? And what's important is the healthcare personnel involved, and in this case it's you yourself, must adequately comprehend and interpret the information. So you have to have a certain level of confidence and knowledge so that you can deliver it effectively. Okay, so I just like to share this slide, this video, sorry. This is a video from the Royal College of Surgeons, okay? And this is, I think yesterday, Datuk Hassan emphasized a lot about informed consent. So let's just have a look at this video, okay?
Informed consent in a patient's shoes. Uninformed consent goes something like this.
See the video?
Okay then, Mr. Miller, we've had your blood test back, your white cells and CRP are up, so we do think it's appendicitis. What we can do for you today is take you for a keyhole operation to take your appendix out and get you better again, okay? It's a fairly low risk operation, just a few cuts in the tummy. There's some risks of pain, of bleeding and infection, and there's a risk that we might need to make that a bigger operation, okay, and cut open your tummy. I've signed here. You could just sign here for your operation today. Okay, and we'll get you up to theatres and get that done today. We'll see you in theatres.
Who is she? What's CRP? What is an appendix? What is keyhole surgery? What have I let myself in for?
Valid patient consent requires information and understanding. Not all patients feel empowered enough to ask doctors questions or to let us know when they don't understand.
Hello again, Mr. Miller. I'm Ellen Jerome. I'm one of the surgeons working for Mr. Philpott, the consultant on call today.
Hello, doctor.
Hello. We've had the results from your blood test back. Some of the markers of infection are raised, which supports the diagnosis of appendicitis. And what we'd probably recommend for that is a laparoscopic appendicectomy. Do you know anything about the appendix or appendicitis?
Not a lot.
Okay, I'll tell you a bit about it now. Do you mind if I just sit here?
Please do,
Thank
yeah.
you. All right. So imagine this is your body. Okay, there are your legs and your belly button's there.
Just a few minutes of explaining to the patient what's happening can make all the difference.
Okay then, Mr. Miller, so just to summarise, we've talked about appendicitis and why we recommend removing the appendix to treat it. We've talked about what your recovery is likely to be and a bit about how we do the operation. Do you have any other questions at the moment?
No, doctor, I feel very well informed. Thank you very much.
I've written out a consent form here, so if you just happy to sign on the line. And we'll see you a bit later for the operation.
Thank you.
These simple steps can improve our patient's understanding. Introduce yourself. Assess prior knowledge and give information accordingly. Use visual aids. Avoid medical jargon. Summarise. Offer the opportunity to ask questions. And with patient understanding comes patient empowerment and trust.
I hope you were able to listen to the video clearly. Yes? Yes, okay. Right.
Yeah.
Okay. So as you can see from the video, there were two scenes. I think the first one shows the not to do, and the second one shows how it should be done, right? So I think we do encourage you to actually practice on your own. Actually, I know when we communicate, is learning on the job. Okay, but I think you do have to listen in, and whenever your specialist do some counseling, all right, I do advise you to be there also, okay, so that you can hopefully pick up some important points. Okay, so why is it, or rather how important is communication, right? Communication is so important that it is actually addressed in the WHO patient safety module, right? And why is it important? Because when you communicate well, then you are an effective team player, right? Because when you are part of a team, you're going to have to communicate information, right? You have to give information to the patients, or if it's an emergency situation, if you're resuscitating, right? You have to give information to the other healthcare providers. So when you communicate well, then only you become an effective team player. Okay, and the other thing is, I think maybe Dato' Wan has also highlighted about effective communication is important because it actually helps you manage clinical risk. Okay, so when you talk about managing clinical risk, and I think Dato' Hassan also mentioned yesterday, right? When there is a complaint, for example, one of the first things that must be done is mediation, right? And for somebody to mediate, okay, you need to be able to communicate effectively. Yeah. So when you do that, then you are making improvements. You are ensuring that the patient is satisfied with what you have explained. Okay, and of course, without having to emphasize this last point, communication is important because that's how you engage your patients and the caregivers, right? So I'm a pediatrician, so I will actually engage the parents. Okay, I do also engage the children, to be honest, right? If the children are of a certain age, right? If they are toddler or if they're adolescent, certainly, I wouldn't just ignore them because, you know, every now and then they will look at you suspiciously and they will be gauging you actually, right? So also try and engage them probably, but not to the point of where you have to impart knowledge lah, yeah, or diagnosis. So you have to engage your patients and the caregivers, right? If it's a geriatric patient, you probably have to engage the children of the elderly. Okay, so when you engage and when you communicate effectively, you are creating awareness and you are providing education, because at the end of the day, when they are discharged, it is them who will continue the care of what you have prescribed. So you have to empower them, right, so that they can continue to play an active role. Okay. Oh, okay. Right. So there are various scenarios in which you are expected to communicate, right? So I've mentioned you probably have to communicate with the patients and family members, or the right column, you may have to communicate with the health personnel. Because remember, you don't work alone, right? You always work in a team. So when you're talking to patients and family members, these are some of the scenarios, right? And I think for you to become a more effective communicator, you have to familiarize what you have to impart in each of the scenario, because it's not the same, right? You could be counseling for a diagnosis. Maybe it's the first time that a child is being diagnosed to have leukemia, right? So you have to know what is it that you have to say. Or maybe it's at the clinic where you have to then put in a new medication, right? And you have to sit down and describe what is that medication, when do you take the medication, possible side effects, right? And maybe you have to talk about prognosis, okay? So how you deliver it depends on the scenario. Okay, you may also be asked to explain procedures. For example, doing a lumbar puncture, okay, or doing a bone marrow aspiration. Okay, and of course you've already witnessed that first video where you are taking consent. Okay, so when you take consent, make sure you are well versed with the procedure or the surgery that is being done, right? So if you're not so well versed, I don't think you should be the one who's taking the consent, right? If you are so junior, right, and if you are in your early practice and you're talking about a more complex surgery, for example, then it should be the specialist or consultant who's doing that, okay? Because you know you have to satisfy the patient's needs. I'm sure there are lots of questions on that patient's minds. Okay, so that's the group about talking about the family and the patients. Okay, what about the health personnel? So when we talk about health personnel, again, right, you could be in a Passover round. So you could be talking about patient management, the treatment, right? For example, well, this patient needs an albumin infusion at about 8 o'clock, but please ensure the Lasix is given at so and so time, right? So you have to give that instruction clearly, right? And you have to make sure that you give it to the right person. And of course, when you're working in a team, right, there is variability in seniority. So the type of information that you give, right, maybe you are a medical officer now, right, you are embarking on your specialty training, you're going to pass over and ask your houseman, right, to trace something. So you have to tell them explicitly how to do it. Maybe they're not familiar with the online system, right? So you have to remember the background of the person to whom you are communicating. Okay, and remember, you work in a team. So everybody is a team member and everybody is important. All right. Please let's not do this thing where we poo-poo somebody, right, in the team. Everybody matters. Okay. And sometimes the things that they do may overlap, right? For example, maybe you want to do a blood gas, right? At NICU. Okay. I'm sorry, all my experiences are of course in pediatrics. Okay. So probably the nurse has to do some suction. So the timing is important. So this is what I mean by shared responsibility. You have to know what is being done at what time and what needs to be done next. Okay. Now let's just look at this scenario here, right? This is all about being an effective team player. This is a scenario in where the treating team did not communicate with each other. Okay. So here, Simon, an 18-year-old man, was brought by ambulance to the hospital. He had been involved in a fight and unfortunately he suffered serious head injury when his head hit the pavement. The ambulance officers were very busy and did not have time to brief the health professionals in the ED. Simon wasn't able to say his name or speak clear words when he was first examined by a triage nurse, then a doctor. The doctor in attendance, an intern who was only weeks out of medical school. Okay, so this is somebody very junior. This intern didn't have a supervisor on that night. All right, this sounds pretty real, right? Yeah. And he and the nursing staff failed to recognize the seriousness of Simon's head injury. Simon had been drinking, and the intern, right, decided that he was just simply drunk. So, a diagnosis supported by Simon's rowdy and aggressive behavior. Okay, however, such behavior can also indicate serious head injury. So, this is tomorrow, it will be touched upon by the trained team. So, don't be so fixated, okay, right? You must look at the whole picture. Simon was then prescribed medication for nausea and placed under observation. On a number of occasions, the nurses and interns separately tested his verbal and motor responses. As time passed, the nurses documented his deteriorating condition in the clinical notes, but did not communicate this directly to the intern. Unfortunately, the intern relied on verbal communications, right? Remember, he's junior, right? And didn't take sufficient notice of the notes. Okay, Simon unfortunately died 4.5 hours after entering the hospital. So this was taken by the patient safety education framework. This is a real case scenario. So it is very unfortunate, okay, that this has to happen. So you can see, you need to communicate and ensure this is the background of a junior staff, right? No matter how busy you are, right, you still will have to communicate. All right. Okay. So these are just some, I'll just go very quickly to this slide, because why do you need to communicate and what are the important factors that can affect communication? Because now the patients who present to us, right, the care is so much more sophisticated. So and if you are talking about a tertiary center like a HCTM here, the patients that will be referred to you are certainly a lot more complex. So you have to be very careful when you hand over. And because of that, right, because of better care, they could also have comorbidities. For example, a patient who comes in with stroke could have, of course, diabetes and hypertension. So you need to address all of that, okay? Similarly with chronic diseases. And I think with this COVID pandemic, there is a global shortage of workforce. So communication becomes even more important because you may not be able to attend to everybody at one go. You need to prioritize. And how do you prioritize? You have to communicate which patient needs to be attended first. Okay. And I think when you communicate, right, these are also important because when you communicate, you ensure that there is patient safety. Okay. And of course, thankfully now, the working hours are much more shortened because back then, maybe Datuk Zul, Prof. Azhar is younger than me, but Datuk Zul, we're probably around the same age, right? Long ago, right, we used to do on-call every other day, right? Maybe this batch doesn't do that, okay? But long hours. So what you communicate becomes even more important, okay? So just consider this scenario. A pregnant diabetic woman admitted for pulmonary embolus. She appears there, right, in casualty. So who are the healthcare providers? As a team player, right, let's say that you are the first one in ED. Of course, here you have the PAC, Patient Admission Center in the obstetric side. But maybe not every hospital has that. So you have to be able, if you're the first person there on the spot, you have to know who are the person that needs to come into the team, right? And you probably think, okay, pregnant woman, pulmonary embolus, I need obstetrician, I need endocrinologist, maybe medical. Okay, I probably need some diagnostic workup. I think I have to contact my radiology friend. Okay, but you know, are all of these personnel involved available at the same time? Maybe not. So then you have to plan your communication well. Okay, right. So I already mentioned this, everybody in the team counts, okay? And the team members should know their role, okay? Interact with one another well because there's one goal, okay? It's one goal, okay? It's to make the patient better and hopefully, inshallah, cure the patient, okay? And you have to work together, okay? You have to have cohesion, okay? You have to respect each other. I think Datuk Mahmud and Datuk Hassan emphasized this many times, okay? Do not belittle the role of another person in the team, okay? And you know, you have to know that you are, what you do is interdependent, okay? Right, and you have to give and take. Let's just say that person was supposed to do the blood gas and struggling to do that, all right? Then you say, you're not going to stand there like, oh yeah, that's your job, okay, you're supposed to do that. So there must be flexibility and you have to communicate. Right? If you're the person who's struggling, you have to tell, I'm not familiar with this, I don't have the expertise yet, can you help me? Okay, right? So if you're not sure and you see somebody struggling, not asking, I think you have to jump in, okay, and offer a hand, okay? So these are just keywords. I think I'll just go through. Do not assume. Okay, never assume. All right, don't think that, oh, I think Dr. So and so is going to chase for the blood, right? You have to make sure, is that Dr. So and so chasing for blood, right? I said, Dr. Zul, has the blood been taken, right? Don't wait and assume, okay? Right? Learning styles. Everybody has their own pace, right? So you have to be a bit more, acknowledge diversity also in the team, okay? So listen. I think when you communicate, listening is always important. Remember, it is bi-directional, okay? And if there are conflicts, right, don't tuck it under the carpet, tuck it in some corner, right? I can guarantee you if that conflict is not resolved, it's going to appear again. And that will make the situation even worse, okay? Right? And somebody will have to take charge, okay? And usually that is evident. Usually is the most experienced person. It may not always be the doctor. It could be the nurse, all right? It could be a senior nurse. Let's say it was a young doctor. So, you have to be respectful, okay? All right? Okay, and always communicate, okay? So these are the other techniques, okay? If you're doing resuscitation, you may have to do a call out, okay? And you always have to check back, all right? And if you are doing a communication, for example, like when you're taking consent or you're at the clinic, so this is an acronym. There are many acronyms I'm going to share, but I'm not going to elaborate so much in terms of because of time, okay? You have to introduce yourself, talk about the situation, background, assess, and then finally summarize and make recommendations, okay? And this is especially important when you hand over. I think some of these are repetitive, okay? But you must have accurate exchange, okay? Skip this, all right? And this is another acronym where I talk about just now was ISBA. Now is I pass the baton. Okay, these slides will be made available. Okay, I do not want to elaborate one after another. But remember, whatever you do, when you have to communicate, my take-home message at this point of time is you have to have an agenda. You cannot go and see a patient and then, what else? What do I need to do next? You must already have an agenda of what you need to say and share. Then it becomes better. Okay, because if you are there struggling and stuttering, right? Probably the patient might also wonder, does this doctor really know what he or she is talking about? Okay, right. So communication, right? I'll just skip the entire slide here, but mention here. It's a common cause of complaint when you miscommunicate. Okay, so please take time in talking to your patients. Good communication is an investment. Okay, right. And again, respect for autonomy, accurate information, and depending on what you're counseling for, please always set appropriate time. I think it will be, the non-verbal cues where you're like looking at the watch, and like, you have to really set some time. If you're going to counsel, Prof. Azhar, right? I mean, Prof. Azhar works in the ICU backup. And if you are going to counsel a patient who is terminal, right, you have to set some time, right? I usually set easily half an hour, even beyond that, right? If they're not ready yet, okay, right, then you have to engage them again. So be mindful of time constraints that you have, that you must plan it well, okay? Right. Cultural differences, right? I think you have to be aware of that. Health literacy, always try and assess what your patients know, okay? And acknowledge cultural diversity, okay? Remember, this the important point here. Is this how I want my family member to be treated? Always remember that, okay? And right, I think you have to be honest, okay? Right? When these are the barriers where maybe somebody may not be honest because they are worried. They're not going to tell the risk, okay? Because they are fearful of legal action, okay? So this is not right, because when you are dishonest, you are acting without integrity. And I think, by the code of professional conduct, you have to be someone who is practicing with integrity, okay? Right. And this is yet another acronym, okay? And we are talking about spikes. So I mentioned about ISBA, okay? I mentioned about I pass the baton, okay? In spikes, we're talking about the setting must be right. You must assess the perception, okay? What the patient is thinking about. Then you impart information, knowledge, give some time for the patient to prepare for disturbing news, and empathy. I'm going to end my talk soon. I just want to share after this one final video about empathy. And I think that video will highlight why empathy is so important. And finally, you have to summarize it all. There must be closure, okay, to your session, okay? Okay, so this is the video. Okay, just a minute. This is a video on empathy. Okay, so I hope you'll be able to hear this because I have to stop a certain screen here.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, woo, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, so that was my video. I got it from a colleague. She's a child life specialist in the United States. Okay, so as you can see, right, empathy is especially important when you are conveying bad news. Okay, and it is not an easy thing to do, right? And there are moments where even I myself still struggle, right? I like to admit that. So it is certainly something that you learn as you go along, okay, and you gain the experience, okay. I'm just going to share my final slide, which actually just shows the resource of some of the other videos, okay. Um, just a minute, sorry. Anyway, it's only the last slide is just a compilation of all the other videos that you can also access. Okay, and I will be sharing the slides. I think there was a question whether all of the lectures will be shared. I think most of our speakers have given permission, right? So we will be able to share the slides. Okay, it will be done through the postgraduate coordinators in your department. Okay, and basically that was just my last slide. Okay, you can see it, right? So this is just, various, you just have to go onto YouTube, right? And there's lots available there. So, okay, Prof. Azhar, I think, being a lecturer, we always talk so much. So, and we probably steal over a bit of the time, but okay, so that's me. Yes.